Okay, let me ask you, doctor. You know, when people talk about cancers, they usually allude to risk factors rather than causes. What would be the risk factors of colorectal cancer?
One of the major risk factors of colorectal cancer, the major risk factor that you can't do anything about is your increasing age. You can't do anything about that. The other thing you can do anything about is your family history.
Okay.
If you have a family
history, it's hereditary too?
Yeah, to a large extent. Most cancers are a combination of your genetic makeup and the environment, right? That's how most cancers are, genetic makeup and the environment. You see, they are like, those are the two major factors that cannot be modified. The other risk factors that can be modified are things like, look, why, though it's been studied, why we have an increasing incidence of colorectal cancer as compared to what was used to obtain maybe in the 60s or in the 1940s, right? Increasing adoption of Western diet. We're now taking a lot of red meat, we're taking a lot of fats. They all contribute to increased incidence of colorectal cancer. I need to emphasize that the highest incidence of colorectal cancer in the world is in the Western countries, New Zealand and US. The incidence of colorectal cancer in New Zealand, Australia, or the US is 10 times what obtains here.
Because of their diet?
Because of their diet. Because they eat a lot of red meat. The average American eats about 180 grams of red meat. I think it's kilogram. I think it's 180 kilograms of red meat in a year. We eat about 8 grams. So theirs is about
8.
We eat about 8 grams per individual. We eat about 8 grams. No, 8 kilograms. I'm sorry. I think it's 8 kilograms.
Even if it's kilograms, that is a vast difference.
The difference
so maybe we should just stick to it.
See, theirs is theirs is 10 times what we eat. So it's not probably. If you extrapolate, you can say, oh, maybe that's why they have 10 times the high incidence of colorectal cancer than we have. But there are a number of protective factors in our environment which we don't
realize.
And
what are those protective factors?
These protective factors, if you eat our normal diet and look at delicacy, eat a further rice, a lot of fruits and vegetables.
Oh, yes.
You are not going it will reduce. I'm not saying it's foolproof. I'm not telling you it's foolproof, but it will reduce your likelihood of having. And more important, you don't smoke, you don't drink. And if you drink in moderation. You don't live a sedentary lifestyle. And you take a lot of fiber in your diet. They will help you in a long way. Naturally, our foods contain a lot of fiber. Right? Our foods contain a lot of...
So our gari has fiber.
Cassava has fiber. Maize has fiber. They all help in a long way in preventing colorectal cancer. But if you adopt a Western diet, high-fat diet, a lot of red meat, it will increase the individual's risk of developing colorectal cancer.
Okay. Niola, did you face difficulties with care? I mean, at some point in time, they gave you the correct diagnosis. What was it like after that?
Yeah, it was a bit difficult getting the correct care. That's the truth, because I've never heard about colorectal cancer in my life. I didn't know anything about it. I've not heard about it. Not until Bola had colorectal cancer. And we actually took him to a private hospital, and they did what they know best how to do it. As I've said, there was a lot of lesson I learned during that process. And then we took him outside the country. He actually died in India. And there was a lesson I learned in India. So when I got back, I was like, wow, I learned some things. I'm not ready to talk about that on this show. But how can I give back from what I've learned? How do I have to help Nigerians? Because so many people will be in my shoe too, and they won't know what to do. And when Bola had the colorectal cancer, when my late husband had the colorectal cancer, there was no NGO I could talk to. I have to go online. You know how it is. Our doctors are overwhelmed. They are doing a lot of work. His oncology doctors, when I ask some questions from him, he would not, because they are so overwhelmed, they won't be able to reply me, to talk to me. So, and I need information. I need how to manage it. I need what to do, because I didn't even know about diet. These are the things I learned. I have to go online, talking to doctors outside Nigeria, talking to NGOs on colorectal cancer outside the country to tell me what to do and how to manage my husband, how to show him care. So those were the things, the challenge. It's a major challenge, because cancer is emotionally draining, is psychologically draining, is
economically draining.
Is economically draining. So, and I have to be there for him. I'm drained as well. He's drained. He needs strength. I need strength. And so these are the things I needed to. I need someone to talk to. There was nobody. In this country, there was no NGO on colorectal cancer.
Doctor, let me ask the doctor, is there a way all this stress can be prevented? Is there a way of catching colorectal cancer early, and can it be prevented?
All right. It to some extent, but with a lot of stipulations. How do you do that? When we talk about preventing a disease, there's this what we call primary prevention, which I've just spoken about. Preventing prevention means you actually doing
modify your lifestyle.
Actually prevent the disease from developing. Right. That is one aspect of it, right? You modify your lifestyle. You don't smoke. You don't take alcohol. You take a lot of fruit and vegetables, right? You reduce your red meat intake. That is primary prevention. The other part is, the primary prevention is actually the cheapest. The other part is secondary prevention. That's a little bit expensive. I won't say it's expensive, but what we can do in Nigeria regarding secondary prevention is we want to pick up the disease very early. How do you pick up this disease very early? One, you have to be your own advocate. How do you be your own? You don't trivialize any change in your body function.
So even the abdominal pain?
You don't trivialize it. Just because your abdominal pain is responding to an over-the-counter medication, you just don't assume, oh, I think it's ulcer or this.
So you're
try and figure out.
It's persistent.
Once it's persistent, you have to figure out what is causing the abdominal pain. Once the abdominal pain is persistent, you have to figure it out.
But then you said that there are some that come without symptoms. What's to be done about that?
You see, they analyze the issue. The ones that come without symptoms, when it comes without symptoms, it's usually very, very early disease. Those are the difficult ones. I mean, the disease is still very early. That's why it's symptomless. This is still very early. That's why it's symptomless. And the only way that can be picked up is if you belong to a high-risk group. If you belong to a high-risk group, the definition of a high-risk group is you have a family. In Nigeria, the definition of a high-risk group, you have a blood relative, a first-degree relative who has a disease. In such an instance, those are the few...
Maybe you're old.
All right, maybe you're old, right? Maybe you're old, right? Maybe you're old, right? Maybe you're old. You can say, maybe you're old, right? Maybe you're old. This high-risk group, if you're the high-risk group, the only person that can define as a high-risk group is if you have a blood relative who has a disease. The only way you can pick up the disease very early in that patient is if you do some specialized tests to pick up the disease.
Okay, so you're talking about screening now.
Yeah. I'm talking about screening.
When you screen a person for colorectal cancer, and what do you see that makes you suspicious? Yeah. We'll take a break now. After the break,
all right,
you go ahead with that one.
Yeah.
We take a short break. When we are back, we'll continue. Stay with us.